For a time, many people were afraid to take care of routine and still important health issues. And now hospitals are seeing more non-COVID related patients. Joining us now to talk about this is Dr. Jonathan Gates, Chief of Trauma for Hartford Hospital and Hartford Healthcare. Doctor, thank you for joining us.
All right, 1, 2, 3.
And let's
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Doctor, can you hear us? It's Lisa at News 8. Hello?
Hi.
Hi.
Yes, Lisa. Hi, Jonathan Gates.
Thank you for joining us live. Let's talk about things. A few weeks ago, serious car accidents were on the rise due to speeding as the state slowly begins to reopen. What have you been seeing more recently?
Well, I think that was correct. During the pandemic, we saw some catastrophic car crashes, and we're continuing to see that because the weather is good. There are more cars on the road. And this also applies to motorcycles. Motorcycles obviously are moving at high rates of speed, and people don't have the benefit of any protection, and that's why they're at risk as well. So we are quite concerned about that. It's the natural sequence that we see. Trauma is a seasonal event, and we are ready for it, and we're willing and able to take care of these patients. But it's sad to see.
It is. And so what are we expecting from these summer months as more people venture out?
Well, I think you'll see that, and motor vehicle crashes and motorcycle crashes will be prevalent, but we will also see jet ski accidents, boating accidents, things like that as well. And clearly, the interpersonal violence continues despite the pandemic, and again, we hate to see that. We have an injury prevention center that's geared toward trying to prevent these events, but nonetheless, they do occur, and we are in a position to take care of these patients.
Okay, let's talk about people have been fearful to go to the hospital because of exposure to COVID-19. Tell us about hospital safety measures that you have in place.
Well, I can understand their fear, but I think it is unfounded. And the reason I say that is that we are well prepared to care for patients who are non-COVID patients, as we do day in and day out anyways. Now, the number of COVID patients in hospital is decreasing remarkably over the last several weeks, and they are now cohorted to other areas of the hospital, and it's unlikely that an inpatient will come in contact with a COVID patient at all. The workforce is queried every day we come in, and we have our temperature taken and ensure that we are not carriers of the virus. We are well prepared with masks. The visitors wear masks. We have all the personal protective equipment that we need to prevent any transmission of the virus.
Okay.
I think that the time is.
Go ahead.
Patients do need to come into the hospital when they have illnesses that need to be taken care of. Things like acute care surgery and appendicitis and gallbladder disease, pancreatitis, all of that needs to be taken care of. And I think patients should feel comfortable in seeking help in the hospital now.
Okay, good to hear. What advice would you have for people to stay safe this summer, Doctor?
Well, it's the same advice we give every year. I think they have to slow down. I would avoid drinking and driving and texting and driving. I think a designated driver is a good idea, and I would like to think that I would really wish that we could see a decrease in the interpersonal violence. I think that we as a community have come through this COVID event. It's not behind us completely, and we're concerned about what the fall holds. But I think that people need to watch out for each other and respect each other, and I would hope that would decrease the interpersonal violence as well.
All right, Dr. Jonathan Gates, Chief of Surgery at Hartford Hospital, thank you very much for sharing your wisdom with us today. We appreciate your time.
My pleasure. Thank you for having me.